Sanket, start.
Okay. Good evening, everyone. Today's webinar is under our project of supportive therapies for MS, and we have short few, I would say, information for you. That is, first of all, we are really want to let you know, all guys know, that all supportive therapies, they are not the cure for MS, but they will definitely help to improve the quality of life for every person with MS. Again, this any supportive therapies, whichever has been started by any person with MS, we should consult your existing neuro, whomsoever it may be. And again, this webinar series is only intended to provide only information regarding all the supportive therapies for MS, including this one. And we have lined for you around, I think, 15 supportive therapies. So this, starting from today, we'll start off with this one. So I think with that, over to you, Hazel, for the rest of the show.
Thank you so much, Sanket. Am I audible?
Yes, you are.
Hazel,
Yes,
you can start.
audible.
Yes, very good. Good evening, everyone. I'm Hazel Els Joseph, and it is my pleasure to welcome each and every one of you to this session. Every one of you is invited to this session organized by the National Youth Wing and Multiple Sclerosis Society of India. National Youth Wing of the Multiple Sclerosis Society of India. I'm so sorry. Today's session is part of our efforts to create awareness and share informative approaches that are transforming the way rehabilitation is provided to people living with multiple sclerosis. We are here to explore how technology like robotics and aquatic therapy would make a difference, more accessible, effective, and empowering in multiple sclerosis journey. Our goal is to bring together knowledge, expertise, and inspiration to help build a more inclusive and supportive environment for everyone. We are delighted to have you join us today from different corners of the country and beyond. We have an exciting lineup of speakers who will share their insights on the latest advancements in MS rehabilitation. Without further delay, let's get started. To begin, I'd like to invite Pooja to introduce MSSI and National Youth Wing. Over to you, Pooja.
Thank you, Hazel. You guys know me very well. MSSI is a voluntary registered NGO which is there in existence in 1985. We work for people suffering from MS like me and Hazel and everybody else here. The National Youth Wing is basically a small section which is having people from under 40, which is the members, and over 40 to 50, we were the mentors. We work together to work on projects like supportive therapies, awareness, advocacy, insurance, etc. MSSI always believes in that we work for MS people, and the core value is to provide a quality of life to these people who are living with a chronic ailment. This supportive therapy is also a small step towards it today. आपसे दरखास्त है, मैं हिंदी में इसलिए बोल रही हूँ क्योंकि इंग्लिश में संकेत बोल चुका है. जो भी सपोर्टिव थेरेपी आप ट्राई करें, अपने डॉक्टर से पूछ लें, उसको बता के करें. सपोर्टिव थेरेपी आपको एमएस से क्योर नहीं करा सकती. देयर इज नो क्योर टू एमएस, बट हाँ, आपकी क्वालिटी ऑफ लाइफ जरूर इम्प्रूव कर सकती है. ओके, हेजल, बैक टू यू. Hazel?
Yes. Thank you so much, Pooja. Now, I would like to invite Jyoti to introduce our first speaker, Mr. Vijay Bathina, a leading expert in neuro rehabilitation, whose work is making a real difference in patients' lives. Over to you, Jyoti.
Thanks a lot, Hazel. It's my pleasure to introduce Mr. Vijay Bathina, a well-known physiotherapist and the clinical director of Atharv Ability, which is a neurorobotics rehabilitation center. He is a leading neuro rehabilitation expert with over 18 years of experience. He serves as a chief mentor at Startoon Labs for PZ, India's first FDA-cleared EMG-based rehab device, and mentors with the Government of India's Research and Innovation Circle of Hyderabad. He is an assessor and technical member of the Quality Accreditation of India and contributes academically as a member of Board of Studies at Mallareddy Digital University and Kaziranga Health University. Vijay sir has been recognized internationally, receiving Best Research Paper Award at conferences in Dubai, Faridabad, Mumbai, and Hyderabad, as well as Sancheti National Award for introducing art in rehabilitation in 2020. He was also awarded Best Outgoing Physio Resident at Brooks Rehab, Florida, USA, and honored in Singapore for innovations in rehabilitation. An innovator, educator, and advocate, Bathina sir combines technology and compassion to transform recovery journeys for patients with stroke, spinal cord injury, and multiple sclerosis. We extend a warm welcome to Vijay sir, and I invite him to inspire us with his address.
Am I audible? Hello,
Yes,
am I audible?
yes, you are.
Yeah, so I was just telling thank you, Jyoti ji, for such wonderful introduction, and then thank you, MSSI Youth Wing, the National Youth Wing, for hosting this and then giving an opportunity to share our work at Authorability Hyderabad. So I will start with this. The next slide, please. Can I have the control? Yeah. So the association and the relationship with MSSI for me is more than a decade ago. Started around 2014 and 15 with Meena ma'am, was the chairperson of Hyderabad chapter. We have started as a home care therapist team with MSSI. We are providing such services across Hyderabad for more than 70 patients across Hyderabad. Later, we joined hands developing different protocols and management systems for MSSI, be it fatigue, balance, and we continued a journey together across different places and programs. Next slide, please. So I just wanted to, it is very nostalgic when I say MSSI and then Amina ma'am. It is synonymous. Without her, I couldn't imagine, but I'm very glad that.
We can't hear you, sir.
Yeah, am I audible now?
Yes.
Yes. Next slide, please. Yeah, so I just like to introduce the background of the center where I am currently working. Atharv is a sister concern of Lupin Limited, which was an MNC pharma company, but headquartered and started in Mumbai, India. Started by Dr. Desh Bandhu Gupta sir, and he's our founder who started this company in 1968. So even I was curious before I'm joining this center, why Lupin have to come into this robotics and or technology-based rehabilitation, particularly neuro rehabilitation. So I was curious. I was asking the leadership while discussing during the transition from the earlier center. So they were very clear that they are not doing this for a revenue or for a growth in their numbers, because when you compare drugs, medicines, and other areas, neuro rehabilitation one cannot equate neuro rehabilitation numbers with medicines. Their values are really high. But what answer I've got from the chief promoter is they wanted to really give back to society. and they have found such gap in neuro rehabilitation segment, saying that we are doing really good in neuro rehabilitation in India, but technology would actually add real-time value by accelerating, the programs. So that's when they came into this field, and then they hired the team for India, for Hyderabad and Mumbai, and then we are now setting up in Delhi also. Next slide, please. Yeah, next slide. Yes. So the belief system, the Atharv ability is born is very simple. We wanted to get this technology to be reached to each individual who is actually requiring this support, and then create an opportunity for them to reclaim their independence and dignity. And we're not just telling this as that we as a generic projection, but it goes across the practices we do in day in and day out we do here. We don't have that system that we want to only tax or price at this service at this. We will be very flexible. We want to be very flexible. This is a message that we got from the promoters. Don't look at the revenue or such numbers. You just see how much good that you can do, how many people can use this well, and then how much opportunity that you can give for the people to recover. So we truly practice this sense of reaching this, creating this awareness, and then making it reachable to a lot of people across. Next slide, please. So this is what is the inspiration. We wanted to create that ecosystem of particularly people with multiple sclerosis, because it is not that we trying to create some cure or anything. We will only help you in transition and make you feel better at that one given stage where you need some support beyond certain extent. Next stage, next slide, please. So I wanted to introduce our team. In the center, we have neurophysiotherapist. Both we do in clinic and then home therapy services. We have aquatherapist, we have cognitive therapist, we have speech and swallow, and we have occupational therapist, and we have pediatric rehab services also. So the very reason to have this, all of them together, is it is very important. It is not just physical dependency. There is a dependency of emotional, there is dependency of functional also. I mean, particularly people, it is not just strength they're looking towards, but also the functionality part of it. For example, someone does a lot of strength training at one place, but still there are areas where they couldn't work. For example, in kitchen, they couldn't really function well. Though they have good amount of strength training back then in the physiotherapy department or physiotherapy clinic. So we want to create that environment and scope and the team where we will deal such individual who is trying to recover with all integrated services like functional rehabilitation through occupational therapy, speech and language, enabling that capacity to communicate well, cognitive therapists to create that hand to emotionally make sure that they are not down at difficult situations. Particularly in MS, we have we will see a lot of remissions and relapses, so that episodes are very typical to be managed. So all such thought process have gone in, and then that's when we have integrated such holistic team, which was very rare to see in any given single center, because a lot of times they're distributed across the centers, or there is a situation where they come in on-call basis. So very few centers in India have this holistic approach. Next slide, please. Yeah. So as my experience is, there are quite a few challenges, but as I'm working with last 1.5 decade with MS, so these are the outline that I have got challenges in MS rehabilitation. One is variability in symptoms and progression. There is no single line progression or symptoms that everyone will tell. Fatigue is one big limiting factor for any person who is having this MS. So dealing that fatigue is very important. And then risk of fall and muscle weakness, emotional and psychological distress, limited access to specialized care, and especially in remote areas. People in urban locations still they have access to a lot of people who are experts in that field. But think of people who are in suburb and rural areas. It's very difficult for them to think also even to get this kind of a holistic care. So we have such models. We have developed such models where we can be accessible even through virtual consultations. Next slide, please. So coming to this robotics or technology, technology is not just robotics and machines. There are other things I'll introduce to you in quite some time. So robotics will assist in repetitive task practice. Robotics will improve gait balance and posture. Robotics will support upper and lower limb strength training. Robotics will offer safe and controlled environment for exercises, and it will reduce burden on therapist while ensuring that right intensity that is going on to the therapist, to the patient. Next slide, please. So how do we integrate robotics with multiple sclerosis is to combine that. We are not saying that we will stop doing conventional therapy. It is like this: we have certain individuals with MS who comes only once or twice a week. So they continue their conventional therapy at home. To intensify their program, they'll just reach us for 1 session, 2 sessions, so that we can actually offer them such intensified program only once a week. Gamified solutions that all we have here, where you don't get a feeling that you're exercising, rather you get a feeling that you are enjoying with doing movements. So your fatigue can be really dealt well, because fatigue is not just physical, is it? And then you can actually participate more. It is fun, and you can actually get rewards when you actually practice. So that creates a motivation for you. I have cross level 1, I have cross level 2. Instead, it is just a game playing, or it is just moving your hands and legs. So coming to the next thing, which was big thing, all of us must have these questions. I deal this thing day in and day out. When we put out such robotic center, next thing comes to mind is it expensive? Is it very costly? Why should we do such costly therapies, right? So technology is expensive. Yes, to buy a technology, it is expensive, right? But to get treated with technology, it is not so expensive. I'll explain you in a few slides. Next slide, please. So I'll just run through this analogy that what it matters when it comes to life is definitely quality of life. It is important. So when you measure quality of life, how much time it will take for us to regain from a compromised capacity. For example, if I aim to recover it, or if I aim to do something functional, and then I started working with a physical therapist, and then I have burnt around 3-4 months time. What if technology can do this in a month or less than 3 months, right? We are gaining such quality of life by using technology as a bridge, and then regaining that quality of life much more earlier. This is what is a proposition. It comes to cost and then quality of life, right? So we strongly believe as a team that quality of life should be offered very early, as early as possible, so that it is really valued well, right? Next slide, please. So it is always good to invest in the possibility of recovery, or possibility of getting better using such smart technology. Uh, it is not just giving you such a platform to enjoy and recover, or enjoy and get stabilized. Also gives an opportunity to measure that it is really going to happen or not, right? So every technology gives a measurement that how much steps you have done, or how many repetitions you have done. So you will get an understanding that how much have to be done to go to that level where I will be well to do. Next slide, please. So yeah, next slide. This is also telling the same thing. Next slide, please. Next slide. Yeah. So we just not telling that we are offering only machine kind of a treatment. It is not just machine. It's a combination of conventional as well as robotic therapy. So I will run few videos for you so that you will understand what is that technology is all about. Okay. Next slide, please. So we also understand that when we say physiotherapy or rehabilitation, it is not that we think it's a generic template to everyone. We understand each individual has different amounts of fatigue, different places of fatigue they get, and emotionally they are different. So it is not just machines that are offering therapy, but we had definitely human value, human touch with conventional based therapy when we see as a treatment plan. Next slide, please. Yeah, so it is also a question that regularly I deal. Okay, fine. The technology is showing that impact and things like that. As I was mentioning, when to introduce this technology? What is the right time? Right. So what we suggest, and what literature is also telling this, there is no need that every MS patient should try robotics or technology. So when a traditional therapy, conventional physical therapy starts plateauing, like you have seen some recovery, spike of recovery from regular physical therapy, but over weeks and months, there is no change in that functionality. right? I should not call recovery, but change in functionality, functional capacity, right? It must have got plateaued. So that's the reason, that's the time where you actually should consider robotics for technology, because it offers that intensive, high intensive and repetitive therapies, and which are very much task oriented, right? Yes, next slide, please. Next slide, please. So I just like to introduce the technologies that we have at our center. Next slide, please. Next slide. I think there should be a video between these two slides, if I'm not wrong. Can you roll the slides? Can you roll the slides? No, roll forward, roll forward. More? Okay, fine. Then go back. Please go back. Yeah. So I think I must have missed to go back. Please go back. Please go back. Please go back. Please go back. Yes. So I'll share such videos about these two technologies. One is Amadio. Amadio is a robot which will actually offer such intensive repetitions for the finger grip in a generic sense, and it is highly adjustable therapy. We can actually offer the patient the isolation therapy also, where we can customize the assistance or resistance to individual fingers also. It is designed to empower your grips and function. Next slide, please. Diego is again a shoulder robot where people have a lot of grips and strengths, but they cannot raise their hands, right? So Diego is a robot which will actually offer such training to the shoulders and gives that freedom of mobility. Next slide, please. Next slide. Yeah, I think this is a video. Can someone play this? So Pablo is again a hand.
We don't have any video link here.
Okay, fine. Then I'll share such videos for your reference.
Yeah.
So Pablo is again a gamified trainer for the grips and strengths at the finger level. So if you see that the patient is playing using a joystick kind of a thing, having that good grip and support, she's trying to play that game in the computer. So this gives her engagement platform or a good amount of interaction participation, while she doesn't get any bore. And then at the same time, she is actually exercising, and then that exercise at that given time is measured very well. We understand at what capacity she is today, and then what have to be developed later. So the physiotherapist will adjust the levels according to the strength and requirements of that patient. Next slide. Next slide, please. So you are seeing a person who's actually looking at a big screen. This screen is nothing but a cognitive robot, where it gives challenges to individuals who has that cognitive decline. Cognition is nothing but ability to think, understand, judge, decision making, all such things. So this will actually create a fun-based screen where it will offer you different amount of challenges to solve. So this is again engagement platform where people won't feel bored. Right. Next slide. I think this video can be played, if I'm not wrong.
This is a static photo. There's no link.
Fine. I'll share all such videos. Yeah. I want to show virtual reality, but here I cannot show anything. Okay, next slide, please. So we have a specialized room where we have equipped with a washing machine and a kitchen-like kind of a setup, TV, refrigerator, etc. The very reason we bought this tool into our space is to give that transition feeling. Like they have done a lot of technology and robotic-based therapy. What if they go home? This translation will happen or not? We don't know. Even it is very difficult to judge, right? So we have created a space where we have got a home like a setting where they are asked to do such exercises and trainings inside the center only. Then they'll get the confidence after going back home. What is that they have to practice, and what is the right balance they have to strike when they walk, and then navigate across different systems in kitchen or the home itself. Right. Next slide, please. Yeah, I think this is also a video. I want to show that how much precision that someone has got, before and after. Before she is not able to even hold or stand. Now she is able to walk, and then she's able to. This is in our center only. where she is actually trained on a technology here, and then later we bought a real bendy, and then she started cutting. So we couple that real-time practice as well as a technology. This is what I'm trying to, project, that technology is not just to create a hype or a fancy thing. It actually creates that, motivation and engagement, and we will create the transition also, right? So that they are confident to practice the same thing at home. They won't forget at the center itself, right? Next slide, please. So these are also videos I think we won't be able to play. There are different, this is, the first one is called Timo, which was again trying to train the balance gamified. The other one is called Lexo. Lexo is a gait robot, which will actually mimic exact physiological gait pattern. Who cannot walk or who have that greater disability, it is definitely going to help, right? Next slide, please. Next slide, and you're going back. So call for action is just look technology as a complementary method, not as a replacement of anything. And we are not claiming without using robotics, nothing can happen. Robotics can only complement your therapist, complement yourself in creating more engagement, method of driving the challenge, not whatever we have. Okay? Thank you so much. This is our team. Yeah.
Can I? Thank you so much, Mr. Vijay sir, for those incredible insights and also for sharing your expertise with us. This was very informative. Now, moving on, I'm pleased to invite Sonia to introduce our second speaker, that is Dr. Anusha, Miss Anusha, an expert in aquatic therapy who is driving innovation in rehabilitation practices. Sonia, the floor is all yours.
I hope I'm audible.
Yes, yes.
Okay. Thank you. Thank you. So, yes, I'm Sonia, a multiple sclerosis patient since 2006, taking an opportunity to introduce Anusha, a certified aquatic therapist and the head of the aquatic therapy department at Atharv Ability, Hyderabad, with extensive experience across diverse clinical setups. She has been at the forefront of advancing neuro rehabilitation through aquatic therapy. Her innovative leadership and passion for patient recovery are transforming the way rehabilitation is practiced today. So, without wasting much time, with a huge round of applause, here comes Anusha. Over to you. Thank you.
Hello, good evening, everyone. That was such a lively and a pleasant introduction. Thank you so much. Hi. I think let's start with the screen share, please. Yes. All right. So basically, what I'm going to talk about is healing with aquatic therapy in multiple sclerosis. Let's move ahead. Just to first quickly brief you, I have done my master's in neurophysiotherapy from Maharashtra University of Health Science, Nashik, and I'm an internationally licensed aquatic therapist from the IATF of Switzerland. I have done specializations across different kind of aquatic therapy techniques, that is water-specific therapy, Badraga's ring method, and advanced neuro rehabilitation. I'm also an executive committee member of the national body, that is the Aquatic Therapy Network of India currently. All right, I am heading the aquatic therapy department here at Atharv Ability, Hyderabad. My association with MSSI would go back to my master's days. When I was doing my master's, I did my research paper on multiple sclerosis condition. So I had association with MSSI to where I could reach out to people living with multiple sclerosis. But let me tell you, it was such a pleasant surprise. I was really like completely pleasantly surprised as to the way y'all kind of take things at stride. And I was inspired. I learned a lot from each one of y'all, whoever has come in contact with me. And I think I would like to generalize that entire emotion to all of y'all going forward. Next slide, please. Yes. I'm sure you all are aware of it, but let me just to connect the dots so that it's easier for me to explain things. Multiple sclerosis, as you all know, is a chronic autoimmune inflammatory disease. It is a neurological progressive kind of a demyelinating condition that affects the central nervous system. So there are different types of MS. There is relapsing remitting multiple sclerosis, primary progressive, secondary progressive, and now we have coined a term of clinically isolated syndrome as well, which may or may not go as a diagnosis of MS going forward. The first episode generally is termed as CIS currently. And depending on how it progresses further, the diagnosis is kind of established going forward. Next slide, please. Yes. So the clinical presentations, I have like kind of set it out into different 4 categories. The motor symptoms is weakness, spasticity, coordination and balance deficits. Sensory is paresthesias, numbness, tingling, burning, all of this, and pain and temperature sensitivity. That is one of the biggest challenges that I have seen everyone faces who are living with MS. Cognitive symptoms like fatigue, it could be emotional and physical, depression, memory issues, and functional impact. All of this have rolled into a functional impact like reduced mobility, balance issues, and in turn resulting into decreased quality of life. I'm sorry. Does anybody want to say something?
You please continue. I will request you all to please mute yourself. Yeah, please continue.
Next slide, please. Okay. So now aquatic therapy, what is that? This is a common question that I encounter. Not maybe all of you are aware of what is aquatic therapy. Whenever somebody asks me as to what is aquatic therapy, the first question I ask is what is their understanding, so that I can kind of connect the dots from there. But I will start from scratch here. Aquatic therapy, also known as hydrotherapy, is a specialized type of physical therapy that is conducted in a water medium, typically in a temperature controlled setting. So we use the properties of water to kind of cater to the needs of therapy goals that we set with each person coming towards us. So aquatic therapy uses the unique properties of water like buoyancy, viscosity, fluidity, resistance, hydrostatic pressure. So it is generally led by a licensed and certified physical therapist or a rehabilitation specialist trained for the same specialty. Not everyone can get into the pool and kind of move and do the therapy. It needs some certain understanding of condition, properties of water, and how to use and what and when. All right. So next slide, please. Okay. So how does the aquatic therapy help? So the therapeutic foundation for each, the kind of properties that I just mentioned, buoyancy. Buoyancy is that upward force, the floating kind of a force that you feel when you get into water. So it reduces the body weight bearing by almost up to 90%, depending on the levels of immersion. For example, if you are immersed until the neck, the 90% of your weight bearing is taken care of by the water. It's shared by the water, so you feel weightless. You are much more free to move. And depending on how much of weight bearing we want, we kind of alter with the levels of immersion. So if you go towards the chest level, it drops down. to 75, then towards the waist level, it is 50% of body weight that you kind of perceive. And that kind of lowers the stresses on your joints and bones, which does not give rise to pain. So majority of the problems is you can't kind of take your entire body weight and move on land. So aquatic therapy comes to rescue that by kind of taking off that body weight bearing that you feel to, and in turn you are much more free to move, and you have much more limits of movement to strengthen, to move around and train your goals. All right. So viscosity or resistance. So for example, to say something about viscosity, if the fluid is much more viscous, the resistance is more. When the fluid is less viscous, the kind of resistance is much lesser. And the temperature has an effect on it. But when the temperatures are higher, the viscosity automatically drops. So we use these kind of physics and the properties of water to kind of bring about natural resistance and improving muscle strength and movement control. And hydrostatic pressure is a pressure force acting on the body from all around. So for any body that is immersed in water, there will be hydrostatic pressure acting on it from all ends of it. So that kind of supports your body, that kind of increases the blood circulation and also reduces swelling, which is one of the challenges that I've seen with most of the individuals living with multiple sclerosis. And thermal benefits. So this is a lukewarm water. For in multiple sclerosis cases, we are very diligent and very particular about the temperature that we set for them during the therapy. Since many of them have heat sensitivity, thermal regulation is a challenge in individuals with multiple sclerosis. So we set the temperature. It's a temperature control setup, usually the ideal case scenario. So we set the temperature at a particular point, which is generally, depending on the ambient temperature, anything between 26 to 31, and nothing more than that or nothing less than that as well. So when it is a lukewarm water, it kind of relaxes your muscles. It also influences muscle tone. We can't change the spasticity or muscle tone directly, but we definitely can influence the muscle tone. So in spastic cases, when you submerge yourself in a neutral warmth, it could be a hot pack or hot water, not very hot, lukewarm water, you will realize that you will feel that your muscles kind of ease up. So that is the influence that I'm talking about. So it influences the muscle tone, improves blood flow, and it helps in thermoregulation benefits. So when you move or work out on land or any kind of activities, depending on your challenges or the severity, the thermoregulation, so like body's capability to bring back that core temperature back to its normal, is kind of a challenge. So in water, that is taken care of because the water is set at a different temperature. It cools you down. It doesn't let you go beyond a certain temperature. So thermoregulation benefits is one of the kind of positives that aquatic therapy offers in therapy like this. Next slide, please. Yes. So going individually, physical benefits, these are all research-based evidences. When we categorize, when we talk about mobility and function, it has improved walking ability. I have a video towards the end which can show that. Enhanced balance control. Since water is buoyant and is supporting you from all ends, there is no fear of fall. You feel weightless, you don't have to manage your body weight. So you can't fall in, like, as opposed to a case on land. So since the fear of fall is not there, your limits of movement are more, so you train better, you train your balance better. But with the fluidity, we can also challenge your balance as to when and how we want. So we have enhanced balance control, increased functional capacity, which is taken care. We have studies which show that has been done over a 6-meter walk test. And better coordinations, balance and coordination deficits are kind of taken care. Coming to strength and endurance, your muscle strength improves incredibly since you can challenge yourself better in a more controlled and a safe environment. Your strength kind of shows the difference. So enhanced cardiovascular function, you might be aware that there are a lot of challenges when it comes to the cardiac output or breathing, breathlessness, your breathing control. You go breathless and dyspnea. Should I continue?
Please continue.
Yes, please.
All right, no problem. Okay. So the breathlessness and everything that is challenging, we kind of take care of that with in aquatic therapy as well. Just kind of challenging your thoracic expansion while you breathe itself is a task that you might experience on land, which is better catered to in water. It has increased exercise tolerance, since I told you the thermoregulation benefits that water has, and you being able to challenge yourself in a safe and controlled environment where it doesn't challenge or throw off your systemic kind of vitals. So you have better exercise tolerance, your stamina and endurance in it increases, and reduce muscle atrophy. All this is not a cure, but definitely helps you control and improve your quality of life. So the entire process, whenever if there is a relapsing remitting case, the next relapse, whenever it comes, you are better equipped to handle that when your muscles are at a better optimal condition. So the kind of atrophy process, since there is constant muscle training, is also kind of impacted and it's reduced. Symptom management, so improved thermoregulation, better to hold your core temperature, reduced spasticity, you are much more freer, your muscles are much more freer to move and much more stronger to move. Decreased palpitation. Water is a wonderful sensory rich environment, so it gives you a lot of sensory feedback and helps you manage your pain, paresthesias much better, so in turn pain reduction as well. So now evidence-based dosage recommendations as per the various articles and studies that we have done on individuals with multiple sclerosis is the ideal kind of duration or frequency is 3 times per week and 45-minute sessions each. And depending on the severity, your condition, your therapy goals, everything, it is assessed and set. The therapeutic goals, even if it is a common kind of a case, each person is assessed when they walk in. We have set and we have tailored customized therapy goals, and then we cater to it. So the kind of intensity varies between light to moderate depending on the individual requirements of goals. The program length is minimum of 8 weeks. So you kind of see the difference in change between 8 weeks to 12 weeks. And there are studies, and you might actually come across patients that who come here, people with multiple sclerosis kind of experience. They have a first-hand experience and they can actually vouch for it. The kind of drastic difference that we see is anywhere between 8 to 12 weeks. And then we move forward. It's a continuous process. It doesn't end. It's just the first step where you actually see drastic results. So the water temperature, as I mentioned, is 26 to 31 degrees Celsius, depending on the ambient temperatures. It depends from season to season, and the ambient temperature, we have to set the temperature of the waters a certain way. And it is optimal for heat-sensitive patients. Next slide, please. All right. So this what we just spoke about is the physical kind of benefits that we saw. Now coming to psychological and quality of life, all this rolled into, that's our end goal. When you feel better, your quality of life is better, that's when you go on better. So it has reduced fatigue, decreased depressions, and improved quality of life. When you know you can move better, you can control things better, that kind of builds the confidence, that kind of automatically puts you in a better mood to initiate movement and do things much better, and your quality of life in turn has a very bright and positive impact. And since the kind of stresses on your joints and your body, the body weight bearing part is completely taken care of by the water, depending on the levels of immersion, as I explained some time back. The fatigue part of it is also taken care of. Since you can move better, you can strengthen better, and automatically the water kind of regulates your core body temperature and helps you build and stabilize that. Your fatigue also that you experience is much, much lesser. So mood enhancement, I think all the water babies in you will kind of agree. Water gives you immediate kind of sense of calm, the kind of happiness and the feel-good factor, the serotonin that is produced, that kind of puts you in a good mood automatically. So there is a significant reduction in a lot of symptoms that is associated with depression. Stress reduction, calming effect of water environment kind of grounds you and kind of puts you in a better perspective to look at your situation and address it better. Self-efficacy, improved confidence in physical activities. You become the confident beings to get this done, and the go get it kind of attitude that I just told that I have always seen in people with MS that I have come across with, that kind of only shines better. And social connection, group exercise opportunities, all of this is the plus that comes with it. So fatigue management, how it is done is the reduced energy expenditure due to the buoyancy, as I told you, and improved thermoregulation prevents heat-induced fatigue, and enhanced cardiovascular efficiency, which means your stamina, your endurance is better, which means, and better sleep quality post-exercises, that in turn all results in reduction in your fatigue episodes. And to talk about quality of improvements, enhanced functional independence, increased participation in daily activities, improved overall life satisfaction, and better coping with MS symptoms. So by this, that I mean is we try to tap the potential that you have to its maximum possible limit. And we try to equip people with living with MS in a best way possible. So whenever your condition kind of throws a new challenge at you, you are better equipped to deal with it. Because that is an unavoidable kind of a circumstances, but that's what we are here for. We equip you better to kind of cater to it in a better way. Next, please. Yes. So the unique advantages of aquatic environment. Why aquatic therapy and not the other therapy? First key advantage, as I have told, is it allows people living with multiple sclerosis to exercise at higher intensity. This is a relative term that I'm saying. Higher intensity and durations that typically is not possible on land while maintaining safety and comfort. And multidimensional resistance. So in water, when you are immersed in water, since there is no particular direction, 360-degree of resistance for comprehensive strengthening. When you are doing a functional activity, you don't need just one group of muscles. You need a composite movement which caters to all group of muscles to bring about that movement. And each group of muscle work in a certain direction. It doesn't all move in one direction. So the kind of resistance and training that you need is also that kind of comprehensive strength resistance training. So water gives you that 360-degree resistance to train better. Now, proprioceptive enhancement is water turbulence improves sensory feedback. As I told you, it's a very sensory rich environment. We actually use this for cases like where the children fall under autism spectrum disorder. So they have very high sensory kind of dysregulations. We use aquatic therapy as like a very prominent medium to help with them. So you can imagine that is the kind of impact water has when it comes to sensory feedback. So water turbulence and just immersion gives you that feel. If you ever have experience gone into the pool, you will feel that kind of pressure all around you. You will feel that that pressure makes you feel good. You instantly feel the pain is going away. You feel calmer, which means your anxiety, everything is interconnected. So psychological benefits, enjoyable social exercise experience, Water is always a feel-good thing. And temperature regulation prevents overheating. That is very common in multiple sclerosis. Next slide, please. Yes. So an ideal kind of an aquatic setup would be a temperature controlled pool setup. This is a picture of our facility at Atharv, Hyderabad. But to show you a kind of pictorial kind of a graphic or representation, I have put that picture and is what we are working at. So there is a pool lift on the right end that you see. That's for safe transfers. People who can't go on with the stairs and lower themselves down. There is a patient lift, which is very safe. You strap the patient on it, and then that safely takes you inside the pool and out of it likewise. And the water is a temperature control pool setup depending on whatever is the need of the kind of therapy goals in that session, that is controlled likewise. There is a water turbulence creator called jacuzzi to create that entire turbulence resistance sensory feedback and give you that strengthening approach. There is a pressure hose for tissue release and massage effects. So when you have a lot of muscle soreness or some kind of spasm with some kind of activities or overuse of a certain group of particular muscles, which is a common thing when you lack strength in a certain activity, the muscle that is intended to work, if cannot meet the kind of requirements, the muscles around and the joints around kind of come to the rescue to go about the function. In turn, what happens is the biomechanics of your body is disturbed and there could be undue load on certain group of muscles, which means it will put, it has to work overtime. And there is bound to be a lot of muscle soreness and spasm, which can be released by pressure hoses, which is another facility of a proper ideal aquatic setup we have here. And it's a wheelchair friendly and anti-slip facility for ease and safety. Each shower, washroom, everything is all kind of taken care of so that the safety and the ease is the utmost priority for us. So this is a glimpse of the facility that we have here at Atharv. So this is built with literally healing in mind, and I am not even making this up. The entire setup speaks healing. That's why that tagline that I use, comprehensive, innovative space built with healing in mind. All right, next slide, please. All right. Please, could you scroll down at the bottom of each image, that the middle one and the right one? It's a video. Could you please try? No. Go back, please. Yes. Scroll down at the bottom of each image. It should, bottom of each image.
There is
Can
no
you
link.
scroll a little
There is
higher?
no link. There is no link, only the static photograph.
All right. You can't roll over the image and find the play button?
No, there is no play button. I am not able to see.
All right. No
Only
problem.
pictures are there.
All right. These are actually all videos, but I can explain it. No problem at all. All right. So now it is not just your gait patterns or your lower limbs or your trunk. It's a holistic approach. Standing in water itself brings about a lot of muscle activation, which is kind of difficult to get about and land when you just stand without a kind of support. So when water is supporting you, but at the same time challenging you, that's the beauty of aquatic therapy. So we make them do a lot of loading activities, weight shift activities, balance activities, engaging your core. These are different kind of activities that we go about. So the left one to start with, from left to right, the first one, we are making them do a lot of core engagement, standing and just squatting and just holding that position there. So here you will see when you go about the same activity on land, you will need like 2-3 people to hold the knee, the back, the hand, and help them kind of go down and pull them up. Here, water does half the thing and they feel much more confident because it's an individual effort more than the other people kind of supporting you. So that kind of builds the confidence and gives you the boost that you have to use to go about the activity. So we start with very small ranges and then we progress likewise. To move on to the second one, we are trying to challenge the balance while engaging the girdle, because every functional activity does not happen, as I told you, does not happen with just one group of muscle. So if you have to even pick one thing from one table to the other, the kind of stability that you need on yourself, and then go about the movement. The stabilizers and the mobilizers have to work together. So we kind of train that with each. Then the third one on the right is the person is trying to move the leg in a clockwise and an anti-clockwise direction. It's a hula loop thing with a leg, to put it better. So here I hardly had to give the certain amount of kind of support at this, but it was not this case initially. So when we started with, I had to literally hold clockwise and a clockwise kind of a movement with the legs while standing. Balance and coordination, that was the magic we saw here. This is now, he can do much better, but this is a video after 9 weeks of therapy. Could you please move on to the next slide, please? Yeah. So here, while walking,
Doctor, sorry to interrupt you. We are running short of time, and there are a lot of questions in the chat box. So can you please hurry it up?
I'll wrap it
Thank you.
up quickly. So these are also videos where the walking pattern and balance and coordination is kind of trained. Okay, moving forward. Next slide, please. Yes. So the key takeaways are significant improvements in physical function, fatigue, and quality of life. No reported adverse events or relapses increase as per studies, applicable across all the severity levels. EDSS is a scale which kind of puts a rater for the severity of each person living with MS. So it is applicable, highly applicable across 1 to 7.5, but this is not a general cut and right statement. Everything depends on individual, but this is the usual general kind of range that we cater to. Optimal dosing is 45 minutes, 2 to 3 times per week, and minimum of 8 weeks to see the kind of change. So aquatic therapy is found to be as an effective and safe intervention for multiple sclerosis patients living with multiple sclerosis across its disability spectrum, as per different various studies. It's all backed by cases and studies. Next, please. Yes. Moving on to the chat box.
Yeah, thank you so much. We will be asking you some questions from the audience. The thing is, we are running short of time, so I'm going to combine a few questions from the audience. So there was a question by Preeti Berry, Mr. Anil and Atul, saying, how do we choose which therapy is good for us? Which therapy is the best for strengthening the upper extremities and the lower extremity? Hand and hold grip, or hold strength, sorry.
So there is no golden rule that only this works or only that works. To each its own, but what we are trying to enlighten here is we have a lot of advanced kind of technology and modalities that can help you with each of this. The aquatic therapy or robotics, everything comes in combined. So in fact, patients who come to us, they always have a combination of conventional therapy, the robotics, the aquatic therapy. You can choose either, both, or all of it. Whatever suits you the best and whatever makes you kind of see the effect and enjoy the best. But robotics and aquatic, being an advanced thing, has come 2 steps forward from the conventional therapy, keeping in mind the kind of challenges that we used to face in conventional therapy. So that kind of gives you a better edge to go about it. There is no golden rule that you should do only this or that, but definitely I think advanced therapy has kind of brought in a much more wider horizon of scope of therapy.
Thank you so much. There's a question from Mukund, Anand, and Pooja asking if there are these therapies available in Calcutta, Mumbai, and Bangalore. Aquatic therapy and robotic therapies.
Yes. So aquatic therapy, to speak about aquatic therapy, and there is Atharv Ability has a center in Mumbai as well. That's at Bandra Kurla complex. So we have robotics, aquatic setup, and all of it combine the same kind of concept, all the entire holistic care under one roof at one of the branches in Mumbai as well. Bangalore, there are definitely kind of centers who have aquatic therapy and robotics, but they're all kind of separated. And I may not have names of it at this point, but definitely there are. But none of them have a holistic kind of an approach. We have it, but it's all in robotic setup separately or an aquatic setup separately. But how extensive is that? I think only when you reach there, you'll know.
Thank you so much. There's another question that I want to ask you. Because especially in aquatic therapy, people with MS, we have a tendency for infections. So how safe is it? Because there are definitely bacterial growths and things like that happening, especially in a temperature controlled pool. When the temperature is somewhere between 25 and 33 that you mentioned, there's a chance of infections happening. So, and the second question that I want to ask you is, how expensive are these therapies? And something that is cost effective, if you can tell an alternative thing to it as well. Thank you.
I am really glad. That was like an amazing question. I am really happy that you asked that. So to bring your kind of notice back to the statement that I've made, these kind of ideal setups are made with healing in mind. So that is also something that will definitely taken care of. So the kind of temperature control setup, it's a specialized setup where the water is continuously filtered and it is chlorinated for disinfection in therapeutic dosage, which is suitable for all the patients. And those are all studied and researched, evidence-based kind of dosages. So, and the water is regularly, it's continuously filtered, weekly changed, and monthly culture reports are done. So it's made sure that it's completely sanitized. We don't let anybody touch the water unless like with unsanitized hands. It's really, really safe, and that is taken because when you have an active infection, we ourselves don't take anybody inside, not even the therapist, patients, anybody inside the water until they kind of take that's taken care of. Once they are free of infections, we resume the therapy. So infection part and kind of sanitation part is really, really kept at the most highest priority because we understand that everybody's immune system is not at par to kind of fight off infections. So all these, and even if you don't have a bowel bladder control, the kind of swim briefs that you have to use, those are all very stringently scrutinized before you're taken into aquatic therapy. So the temperatures are also not too cold or not too warm. So those kind of the temperature range that I told is taken care of. Maybe made sure that there are no kind of bacterial or any kind of culture growth.
Yes, thank you so much. We have a lot more questions, but we'll have to stop here.
Wait. There's a patient who wants to ask a question. Dipali. दीपाली आप अनम्यूट कीजिए अपने आप को.
Dipali ji, please go ahead.
Yes. मैम जो नॉर्मली बताता है कि जो हम सीखते हैं, अगर हमने रोबोटिक्स से सीखा है तो हम लोग फिर उसको जब नॉर्मल, जैसे मैं वहां चलना सीख गई, बट मैं जब वॉकर से करूंगी तो मुझे नहीं आएगा. मैंने मशीन से सीखा है, तो क्या ये वहम है या एग्जैक्टली मतलब जो ये कंफ्यूजन है कि
बिल्कुल
हमें
वहम है. क्योंकि थेरेपी रखा ही मतलब थेरेपी डिजाइन ही ऐसे होता है ताकि आप वो आपके रेगुलर डे टू डे लाइफ में यूज कर सको। तो मशीन से सीखा है, मशीन क्या सिखाता है, जो आप यूजुअली आपको बिना वॉकर के साथ या आपको बिना किसी सपोर्टिंग एड के साथ जो यूज करना आता है वो कैसे करना है वो सिखाता है। रोबोटिक्स सिर्फ वो लोड कम करता है जो आपको बहुत ज्यादा एक्यूरेट काइंड ऑफ रिजल्ट्स देगा। सो ऐसा कुछ नहीं है कि आपने मशीन में सीखा हो तो आप लैंड में नहीं कर सकते, आप बिल्कुल कर सकते हैं, क्योंकि वो करने के लिए ही आपको सिखाया जाता है। और वो पूरा थेरेपी का प्रोसेस अगर आप फॉलो करोगे तो आपको पूरा, जैसे डॉक्टर विजय ने बात की थी, आपको वो एक नॉर्मल होम सेटअप में कैसे यूज होता है, आपको चलते हुए क्या क्या दिक्कत आती है, वो सब चेक करके सिखा के वो ट्रांजिशन का प्रोसेस भी थेरेपी का ही पार्ट होता है। तो बिल्कुल वहम है कि आप मशीन में सीखोगे तो आप वॉकर के साथ चल नहीं पाओगे, वो थेरेपी है ही इसलिए ताकि आप खुद से बाद में चल सको। थैंक यू।
I think we're done with the questions, right?
We don't have much more time, so
Yeah.
let's switch on our cameras for a group photo now. Can I request everyone to switch on the cameras?
Thank you so much, Anusha.
Ma'am,
Ma'am, yeah, thank you so much for answering all the questions.
Yes,
It's
thanks a lot.
completely my pleasure. We are always open when you come around, or if you want to reach out for any kind of queries, we are right here.
Thank you so much.
This was very
क्वेश्चन है तो आप
informative.
लिख
Thank
सकते
you.
हैं, आप क्वेश्चन आंसर करेंगे हम। अभी इस समय टाइम नहीं है, पर क्वेश्चन का आंसर आपको मिलेगा।
बिल्कुल।
Can I have the cameras on, please?
Yeah.
All of you, please turn on your cameras. We'll take a cool photo.
Perfect. On the count of three, we smile. 1,
Okay.
2, and 3.
Looking at your
Thank you so much.
faces, I'm already smiling.
I'll just take one more for. Thank you so much.
No problem. Completely our pleasure.
Dimple,
Thank
it's
you so much,
over
Vijay.
to you now.
Yes, Dimple, I invite you for the word of thanks, please.
Thank you so much.
Thank you very much. We should have more programs like this.
Of course.
We will. I'm sure we will. With your initiative and everything, I'm sure we will.
Thank you.
Okay. Thank you very much. It was a very enlightening program. Thank you.
Thank you. A heartfelt thank you to our esteemed doctors for sharing their invaluable knowledge
Thank you, Dr.
and
Anusha.
time. To our
हम
wonderful
लोग
audience.
स्विमिंग पूल में जाके खड़े हो
Okay, I'll tell that again. A heartfelt thank you to our esteemed doctors for sharing their invaluable knowledge and time, and to our wonderful audience for being with us today. Special appreciation to my MS Supportive Therapy team for their dedication, and sincere gratitude to Multiple Sclerosis Society of India, Venki and Javed ji for all the support and encouragement. And of course, a warm thank you to my online team, Sanket, Arun, Pooja, Hazel, Jyoti, Sonia, and everybody who made this webinar a successful one. Together, we all made this webinar a true success. We look forward for connecting again in the future webinars and wishing you all a wonderful weekend and a wonderful day ahead. Thank you, everybody. Thank you for being here.
Dimple.